The knee, the largest joint in the body. The knee is the largest joint in the body. There are 3 bones involved in the knee joint: the femur, the tibia, and the patella. The knee can be highly stressed due to the weight from the entire upper and most of the lower body. It is very complex in its structure and classified as a hinge joint. Additionally, the knee joint will permit some medial and lateral rotation. The knee consists of 3 individual joints that work together: the patellofemoral joint, which is considered to be a partly synovial gliding joint, and the 2 synovial hinge joints that connect the femur with the tibia. These 2 are the lateral tibiofemoral joint and the medial tibiofemoral joint, respectively. As can be seen, there are 2 pads between the condyles of the femur and the tibia, as part of the lateral and the medial tibiofemoral joints. These pads are the medial meniscus and the lateral meniscus. The shape of the menisci resembles the shape of a half moon, and they are sometimes referred to as the semilunar cartilages. Their purpose is to take stress off the knee by padding the condyles of the femur. The menisci consists of fibrocartilage. The medial meniscus is more likely to be injured because of its firm attachment to the medial collateral ligament and its wider C-shape. The lateral meniscus is more circular than the medial meniscus, and therefore more stable, which means it is less likely to be injured. Both menisci are anteriorly as well as posteriorly connected to each other through the transverse ligament. The knee joint is held together via a complex arrangement of ligaments. In total, there are 7 ligaments and 1 tendon. The anterior and posterior cruciate ligaments, the 2 intracapsular ligaments, are found within the joint capsule. As can be seen, both ligaments are attached from the posterior side of the distal femur and connected to the eminence of the tibia anteriorly and posteriorly. Both the anterior cruciate ligament and the posterior cruciate ligament are supporting the knee and preventing undesirable movements, such twisting when the knee is extended. The anterior cruciate ligament is weaker than the posterior cruciate ligament and more at risk to injury. It also heals very slowly, if at all. There are 2 ways to repair the anterior cruciate ligament. One can use part of the Achilles tendon, also known the calcaneal tendon, or part of the patella ligament. On either sides, medial and lateral of the knee joint, are 2 collateral ligaments. These ligaments are extracapsular and are superficial to the joint capsule. The medial collateral ligament, also referred to as the tibial collateral ligament, descends from the medial condyle of the femur to the tibia. The lateral or fibular collateral ligament connects the lateral condyle of the femur to the fibular head. Both ligaments prevent the knee from hyperextending or the leg from twisting medially or laterally at the knee. The medial collateral ligament is often torn when hit from the side, as can happen when playing soccer. Pressure forces the medial collateral ligament to give in and possibly rip. The oblique popliteal ligament crosses the posterior side of the joint capsule. The arcuate popliteal ligament arches from the fibular head over the tendon of the popliteus muscle to insert on the posterior capsule. Both the oblique popliteal ligament and the arcuate popliteal ligament stabilize the knee joint posteriorly. The patella is connected to the knee joint superiorly by the quadriceps tendon, which is also the insertion of the muscular group, the quadriceps, and inferiorly by the patellar ligament. The patella is a triangular bone that protects the anterior side of the knee joint. The patella also plays a vital role in how the knee joint bends by increasing the bending angle. Interestingly, with the patellar reflex or knee jerk reflex, one can test the response of the L2, L3, and L4 segments of the spinal cord by striking the patellar ligament just under the patella with a reflex hammer. Several bursae are in the knee joint, which reduce friction between ligaments or tendons and the underlying bone. Each knee contains at least 1 dozen bursae. The most prominent bursae are the suprapatellar bursa, the deep infrapatellar bursa, and the subcutaneous prepatellar bursa. The suprapatellar bursa is located on the anterior distal end of the femur, just deep to the quadriceps tendon and under the superior part of the patella. The deep infrapatellar bursa is located between the infrapatellar fat pad and the patellar ligament. The subcutaneous prepatellar bursa is, unlike the other two, superficial to the patella, just underneath the skin. This bursa often is injured when the knee is hit anteriorly. A common injury in American football is what is called the unhappy triad. In this case, the anterior cruciate ligament, the medial collateral ligament, and the medial meniscus are ruptured. As discussed earlier, the three ligaments and meniscus respectively are the weakest of the stressed structures. In conclusion, the knee joint serves in flexion, allowing daily routines like ambulating, running, and jumping. However, the knee is very susceptible to injury due to its complexity and stress through body weight. The knee joint recovers, when injured, only slowly, if at all. This video was prepared as part of the course requirements of Human Anatomy at Saddleback College.